Welcome back to the NExT Appraisal Tool modules. This module addresses question 12. Are the data collection processes clearly described? A well-planned data collection process supports the accuracy of information collected and the validity or credibility of study results. Investigators develop this detailed plan or protocol that identifies what data are collected, who collects it, how, timing, and where. In thinking about who collects the information, there can be a variety of individuals with varying backgrounds that can contribute to inconsistencies, whether it be participants, research team, or clinicians. Larger studies tend to have larger number of individuals collecting the data. Regardless of who and how many collect the information, there needs to be clear instructions along with training and education as data collection goes from simple to more complex. As data collection becomes more complex, the author will often mention the data collectors were trained and in some cases provide a few details about the training. Overall, when data collectors consistently adhere to the data collection protocol, the stronger the validity of the data, then the stronger the evidence for clinical decision making. However, it is critical that the author selected measures of study variables that were valid and reliable. This refers to whether the measures themselves accurately or consistently measure the intended information. Measurement is foundational for the results that we can trust. You'll learn more about the validity and reliability of measures in another module. Other factors that might contribute to inconsistencies in data collection and therefore influence the confidence we have in study results include the study setting. Consider if the environment has the privacy needed for truthful answers, or if the study is collected in a clinic or hospital, where the data collector is rushing through a survey so it was completed by the time a patient is called into an exam room or ready for hospital discharge. If a patient's interviewed at home, are they more comfortable? Does the data collector take their time so they get a comprehensive picture of what's going on? When data are collected, also impacts patient recall. Also called response bias, recall bias is a systematic error caused when individuals' memory of an experience differs from the actual experience that occurred in the past. The further away from an event, the less accurate an individual's memory. Compared to retrospective studies, those looking into the past, prospective studies, those looking into the future, will minimize recall bias. In thinking about how data were collected, the type of survey or interview can affect the validity of data. For example, using a focus group interview rather than an individual interview may influence response bias because group members might not feel comfortable having different opinions, or they might not be comfortable sharing a specific experience. This would result in the data that's less accurate and less complete. Let's look at an excerpt from a study to answer our appraisal question. In the text, PA refers to physical activity. IHD refers to ischemic heart disease. This pilot evaluated the feasibility of conducting a larger randomized controlled trial to test the effectiveness of an intervention designed to reduce hopelessness through enhanced physical activity in patients with ischemic heart disease. Motivational interviewing was a key component of the intervention. You may wish to pause the video while reading and then move to the next slide when you're ready. Your appraisal response should reflect how well the article prepared you for understanding the complete data collection process. These authors provided numerous details about who collected what data, where, and timing. Information was clearly written. One piece of information that was not included is whether the participants completed hard copy or pen and paper questionnaires or electronic. However, given this information is not sensitive in nature and the measures seem straightforward, this likely did not affect the validity of data and ultimately study results. Congratulations! You successfully completed this module. You may return to the main menu or continue to the other appraisal modules and the NExT EVP course.